We just finished the pathogen section. We talked about the pathogenic bacteria, the pathogenic viruses, the pathogenic parasites, and now we're going to move on to one of my favorite things to come up on the GI map test because we have such an amazing product that works so incredibly well to treat it, and that is H. pylori. And this is really where the GI map test shines because it includes the virulence factors for H. pylori, which means how likely is this H. pylori to create issues such as stomach ulcers or ulcers in the small intestine. So how likely is it to develop into a disease that is associated with that microorganism? So with H. pylori, the thing to keep in mind is that recent studies have shown that nearly 50% of the world's population may harbor H. pylori. So it's incredibly common. Not all of the people who harbor H. pylori are going to develop signs and symptoms, so not everyone needs to be treated. And that's why we can really look at the virulence factors and say, okay, how likely is this H. pylori infection to create those clinical signs and symptoms of ulceration or gastrointestinal reflux or burning or heartburn? And from that, in combination with the patient's signs and symptoms, we can really develop an awesome treatment plan for them. And although many carriers are asymptomatic, we do know that H. pylori does has a causative role in ulcer formation, chronic gastritis, and stomach cancer. So really important to look at how likely is the strains that this person is harboring, how likely are they to develop the ulcers, the gastritis, the stomach cancer. Additionally, in early phases of colonizations, patients may experience hypochlorhydria, so a lowering of the stomach acid, followed by a change in production over time. So it goes from hypochlorhydria to hyperchlorhydria. So we really need to look at what are the patient's signs and symptoms, because if you have a patient with H. pylori, strong virulence factors, they are symptomatic, they are experiencing hyperchlorhydria, this would not be a good time to put in things like betaine HCl or digeszymes, because if they have too much stomach acid being produced, adding those on would create more of an issue. So the root cause is to address the H. pylori, eradicate the H. pylori, then consider, based off of other markers on the GI map test, if it would be a good time to add in those digeszymes, those betaine HCl. Over time, H. pylori strains may colonize, and those with the virulence factors have the increased disease potential. H. pylori comes from fecal contamination, oral to oral, and family interactions are common modes of transmission. We are seeing things like dyspepsia, which is indigestion. You might see some heartburn, abdominal pain, nausea, vomiting, as well as bloating in the upper stomach area right below the rib cage. You could also get peptic ulcers, and the risk with H. pylori, especially with those ones with the virulence factors, we're going to see mucosal atrophy, damage to the mucosal lining, and over time, the more damage that you have, you can get into those pre-metaplastic changes, precancer cells, cancer cells. Again, virulence factors means the severity or harmfulness of the disease or poison, how likely is it to create the pathogenesis, the signs and symptoms of disease. And this is where we can look at the GI map test for these various virulent factors that are known to create inflammation, long-term infection, gastric cancer, peptic ulcer. Again, here, same thing, inflammation, duodenal ulcer, gastric cancer, decreases mitochondria associated with gastritic inflammation, peptic ulcer disease, gastric cancer. So looking at, even though this person has H. pylori, if they're not symptomatic and they don't have any virulence factors, then that's probably time that we don't require treatment. If those symptoms do develop at some point in time, then you have it on the back burner, keeping it in the back of the mind that maybe you want to require treatment at a later stage if it does become an issue. But it's really when you have presence of the H. pylori as well as the virulence factors that you're wanting to consider treatment. Even if a patient of mine is asymptomatic, they have H. pylori come up on the GI map test and they have virulence factors, I'm treating it. So here's what the GI map looks like for the H. pylori. Again, you can see a lot of these virulence factors are present. And another really cool thing is it'll show you antibiotic resistant genes. So typical pharmaceutical therapy for H. pylori is the use of 4 antibiotics, quadruple therapy. Now, the reason they keep having to add on antibiotics is because of this antibiotic resistance that we're seeing. So this here will show you, do they have resistance to various types of antibiotics, and would a herbal antimicrobial product be more potentially beneficial for them because they are not as resistant. Now, treatment, asymptomatic patients, again, may not require treatment. You may want to consider herbal formulas such as Gastromend, amazing, 2 twice a day, 30 minutes before a meal, works wonders. Oil of oregano, Herbivale. And we also want to look at the pancreatic elastase, which is a marker of pancreatic digestive function, to see if maldigestion and or if hypochlorhydria versus hyperchlorhydria is present, because again, you don't want to add more HCl if they're already producing acid, or you never want to add more HCl if someone has an active ulcer. You can consider Probiomed 50 or 100 and rebuild the healthy gastric mucosa by giving things that are soothing like GI Revive, glutamine, aloe. Aloe vera actually has anti-H. pylori properties as well, in addition to be healing and soothing to the digestive tract. Here is the all-time hero product that I use all the time for H. pylori. It's got masticum in it, really effective against H. pylori infections, antimicrobial. Methylmethionine sulfurium, this is that vitamin U from the raw cabbage that has been studied extensively for its beneficial role in aiding the damage as well as the eroded intestinal mucosa. DGL is another great one as well because it's anti-ulcerative properties. It's healing, it's mucilaginous, meaning that it's going to coat and soothe the lining as well as healing up those ulcers and inflamed tissue. And the thing to note about Gastromend, which makes it unique, is DFH has standardized the DGL in the Gastromend to contain less than 3% glycyrrhizin. So it's not going to raise blood pressure. That's why it's called deglycyrrhizinated licorice. So it doesn't have those properties that will raise the blood pressure, lower potassium and fluid retention. Now, in a healthy person, this is not an issue, but in someone who has elevated blood pressure and who is on medications, this is where this product stands out because it's not going to have those negative consequences of affecting blood sugar. This extract is 10 times higher in flavonoids than non-standardized DGL, and these flavonoids play a major role in repairing the gastric damage. So you really want to choose a DGL product that is standardized with high percentages of flavonoids for its beneficial clinically relevant properties of healing the gut mucosa. Zinc carnosine as well, anti-H. pylori, protects the mucosa, anti-ulcerative properties, protects the lining against damage, and then of course there's a little bit of vitamin C in there to help with tissue healing ability. The other one to consider, of course, is the aloe as well on top of this. Gastromend and aloe would be a great combination for someone with H. pylori with clinical signs and symptoms.